Hi, I'm Kimberly McGuinness. I'm an adult nurse practitioner for Inspira Health. I am a wife and mom of 3 beautiful girls. Emma is 14, Cora is about to be 4, and Audra, who just turned 1. A year ago, February of 2020, I gave birth to Audra. When I left the hospital with Audra, I was diagnosed with postpartum depression, and COVID just made the anxiety so much worse. Being home with just the baby to being home with all 3 girls, being a stay-at-home mom and a teacher, while my husband had to continue to work because he was an essential worker. I was really struggling with the concerns around breastfeeding. You know, formula was off the shelves, diapers were gone off the shelves, and if something happened to me, how was I going to, if I got sick and my milk supply dried up, how was the baby gonna eat? It was really anxiety-provoking and really daunting. I felt like the weight of bringing home the virus from work to my family was so much heavier than this opportunity to pass on some passive immunity through the vaccine to Audra, my youngest daughter. There had been research that had been done on this for a decade, and this is the first that so many of us are hearing about it. And the technology was so impressive and really amazing. I learned that this wasn't a live virus, that it wasn't going to replicate DNA in my body, that I wasn't going to pass the virus to my daughter through the breast milk. As through talking to my husband and really thinking this through, we decided that it was time for me to get vaccinated. So the day I got the vaccine, I was out walking with the girls and just suddenly realized how much my anxiety had decreased. I finally, for the first time, just felt so much lighter. COVID still comes up for most of my visits with patients. The anxiety around COVID, all these unknowns. We are able to offer telehealth appointments for both primary care and specialty care. And it's been a real blessing through this. We're able to talk to patients in their homes. Patients definitely seem to be more comfortable, in their own homes, being able to talk about these things that make them feel really vulnerable. And a part of that, we were able to incorporate behavioral health into primary care, which has also been really helpful, especially for these, patients, particularly moms that are dealing with this anxiety and depression through this. We've been able to use this as a resource and refer them to our clinical psychologist and her team. This tough year was really tough, but like everyone else out there, we just figured it out and just kept rolling with it. It allowed us to slow down and really enjoy our girls. We realized that we really need to be more intentional with them, putting the cell phones down and putting them away, and really being more intentional about our time that we spend with the girls. It's been so long since we've seen a lot of our friends and family. I think we're looking forward to a nice big party at the end of all this. I know that plenty of people still have questions about whether or not to get the vaccine. Primary care is a great place to start. Come and talk to us. We're happy to connect you with services. We're happy to talk to you about any of this, but know that you can always start with primary care and come and talk to us and give us a call.